Welcome, everyone, on behalf of the American Heart Association, the American Stroke Association, and our Healthcare Certification Division. I would like to welcome you to today's webinar, From Quality Improvement to Certification, Real-World Success Stories in Stroke Rehabilitation. My name is Tawny Jackson from the American Heart Association, and I am the host for today's webinar. Before we begin, I'd like to quickly review some housekeeping items for today's event. Next slide. This is just a quick disclaimer. The recommendations and opinions presented by our guest speakers may not represent the official position of the American Heart Association. The materials are for educational purposes only and do not constitute an endorsement or instruction by the American Heart Association. The American Heart Association does not endorse any product or device. Also, all attendees are muted for today's webinar. This session is being recorded and will be shared after today's event. You will have the opportunity to submit text questions to today's presenters in the question section. You may send in your questions at any time, and we will review the questions during our Q&A at the end of the presentation. It is now my pleasure to introduce our distinguished speakers for today. Tricia Heller. Tricia has over 30 years of experience as a respiratory therapist, beginning in critical care and later transitioning to LTAC before joining Marquis 11 years ago. In 2014, she became the first full-time employed respiratory therapist in skilled nursing in the region, starting at Marquis' third center and helping drive clinical innovation across the portfolio. She has led the development of hospital-aligned specialties, including Marquis' AHA heart failure certifications beginning in 2021 and now spanning nearly 40 centers. In December 2024, Marquis achieved another milestone by becoming the first post-acute provider in the nation to achieve AHA's skilled nursing facility stroke rehabilitation certification at its Mount Holly Center in New Jersey. Our next speaker is Valerie Lohman. Valerie is a registered nurse with more than 26 years of healthcare experience. She began her career in the hospital setting, specializing in cardiac care and ICU care, and holds a master's degree in nursing. Valerie is also passionate about education and served as an adjunct professor in the RN program at Mercer County College. After transitioning to long-term care, she joined Marquis 9 years ago, initially as a director of nursing and now as a regional director of specialty services. She helped support Marquis' AHA heart failure certifications in 2021 and played a key role in achieving the nation's first AHA skilled nursing facility stroke rehabilitation certification at Mount Holly Center in New Jersey. Our next speaker is Diane Vernon. Diane is Vice President of Business Development at Future Care with more than 35 years of healthcare experience and over 18 years in leadership with the organization. She has overseen admissions, care and case management, marketing, business development, and new program implementation, and is known for her strong clinical and operational expertise. Diane has been instrumental in building collaborative relationships with hospital systems across the Baltimore and DC metro areas, advancing seamless care transitions. She led the development of Future Care's Vital Strong programs and successfully guided the organization through AHA heart failure and stroke certification. Diane holds a Bachelor of Science from the Indiana University of Pennsylvania and a Master of Science from Syracuse University. Catherine Nicholas. Catherine is the Regional Clinical Network Manager with Future Care Health and Management. With more than 20 years of nursing experience and 13 years at Future Care, she provides clinical leadership and strategic support for program growth across pre-admissions, admissions, and skilled nursing teams. Catherine has served in multiple leadership roles and has most recently partnered with the care teams to achieve American Heart Association certification for heart failure and stroke rehabilitation. She is committed to advancing quality patient care, improving outcomes, and ensuring patients and families receive comprehensive education and support. Next up is Haley Hoffman. Haley graduated with her associate degree in nursing from Kirkwood Community College and her Bachelor of Science in Nursing from Upper Iowa University. She has been a nurse for 9 years and in her current role as Patient Outcome Coordinator and Utilization Review for about a year at Jackson County Regional Health Center. She has 2 daughters, ages 2 and 4, who keep her very busy outside of work. And last but certainly not least, Hannah Root. Hannah is the Patient Outcomes Coordinator at Jackson County Regional Health Center. and Hannah was instrumental in leading the Jackson County's achievement of skilled nursing facility stroke rehabilitation certification in December of 2025. It is now my pleasure to turn today's presentation over to Hannah and Haley from Jackson County Regional Health Center.
Hello, I am Haley and we have Hannah here. She's not showing up on the. There we go.
Okay, I'm Hannah. So we are from Jackson County Regional Health Center and we are located in Maquoketa, Iowa, a very small community on the eastern side of the state. We have a population of 6,000. We are a 25-bed critical access hospital that offers skilled nursing to patients, and we achieved the American Heart Association Skilled Nursing Facility Stroke Rehab Certification in December of 2025. Next slide. So what pushed us to go for certification? So we really seen this as an option to help serve our community members better and the surrounding communities. We live in a very rural area here on the eastern side of the state. We saw certification to help enhance the care that our team provided to post-acute stroke patients and to provide community members with high quality rehab close to home. We are seeing patients come in to our outpatient rehab department following discharge from the hospital, and they hadn't been offered our skilled services, didn't know that this was an option, and they would ask more about how we could help them in the post-stroke state. And so that was really kind of our push as well. Next slide. So what was our journey to certification? We participated in the Iowa Mission Lifeline Stroke Initiative. We began that in the spring of 2023 through July 2025. I attended the monthly statewide learning collaboratives and worked toward implementing the post-acute stroke standards that we didn't already have in place. We did have some current protocols and policies that we could use towards this initiative. We just needed to make a few updates and modifications to those. We focused on key care standards to enhance our program by offering the FEES studies, implementing depression screening, and enhancing patient learning assessments. We contracted to pursue the certification through the American Heart Association in June of 2025, and we completed our certification in December of 2025. Next slide. So our first quality improvement focus area. So about the time that we started the initiative, we no longer had on-site radiologists. So we couldn't complete the cookie swallow test anymore. I had attended one of the stroke conferences here in Iowa, and there was a speaker who had given a presentation on fees. So the rehab manager and myself spoke with our speech pathologist, and she was willing to undergo the training for this. The fee studies has allowed us to continue to care for our patients with swallowing concerns throughout our facility. There's no radiation associated with the fees, and the system is portable. So she's able to do these at bedside if needed. And we are able to use these for both skilled patients, inpatients, and outpatients. Next slide. So our process in order to do the swallow studies and then to get the fee set up, nursing completes a bedside swallow screen within 24 hours of admission. They do that by using a teaspoon of water. And if the patient shows any signs of aspiration, difficulty swallowing, then we get the speech pathologist involved. So she then does a bedside swallow evaluation as soon as possible for the patient who has the identified concerns, and then she completes a FEES within 24 to 48 hours at the bedside. And then from there, she'll provide recommendations to the team, patient, and family. Next slide.
Another improvement focus we had was the depression screening. It was not performed prior to starting the Mission Lifeline initiative. So now we do it for all stroke patients. We utilize the PHQ-2 and the PHQ-9. And these tools were already built into our electronic health record system. So now our new protocol is to complete the depression screening within 72 hours of admission. That's either completed by one of us or the admitting nurse. And then just educated all the nursing staff on how to use the tool and where to document it. And then if the screening is positive, we have a mental health services that can be provided through telehealth. Excellent. The next focus that we had was the patient learning assessment. This is a paper document that we utilize to determine how the patient learns best, identify any barriers to the learning, and what their baseline knowledge is. It helps the team to modify patient education as needed. We now use this with all of our patients, skilled, inpatient, outpatient. And then the assessment is completed, like I said, by us or the admitting nurse. And then we place it in the patient's chart or paper chart. This is just a picture of what we use. It just gets their preferred language, preferred method to receive education, their baseline knowledge of the patient's or family member's condition, and then health literacy, baseline independence, and anticipated challenges for the patient to find areas we need to focus on for learning for the patient. And then as far as goals for the future, we would like to see just to grow our post-acute patients census. Goal is to serve at least one post-acute stroke patient per month. And one way we're trying to do that is just to get our word out that we are stroke certified now. We share the certification achievement with our nearby referring hospitals, worked with our marketing staff to notify the public of our stroke rehab program and certification, and then also do like on-site PR with other social workers at bigger hospitals, just to make sure we're on the list and patients that are from our area know that we offer those skilled care, and then just sharing word of mouth with patients in our clinics.
Hi, good afternoon. My name is Diane Vernon, and I am the Vice President of Business Development with Future Care. And it's an honor to be here today to talk about our journey to stroke certification. Future Care is a locally owned and operated company in the state of Maryland, and we have 40 years of experience in providing post-acute care here in Maryland and the DC metropolitan area. One of the things that I think has really helped us through this journey is the fact that over those 40 years, we've built really strong collaborative relationships with our hospital partners across Maryland and DC. And regular quality meetings with these hospitals has really helped to ensure that we're meeting both the needs of the patients as well as meeting the hospital's goals. Through those meetings, we've been able to identify some of the types, the patient populations that the hospital has struggled with lengths of stay, with quality, and just finding good partners, to work with in providing those rehabilitative services. As a company, we use physical medicine and rehab, physiatry in all of our facilities. And two of our physiatrists actually work for two of the large teaching hospitals in the state of Maryland. And were able to share with us that those hospitals a few years back had received national certification at the hospital level for stroke. And so we saw an opportunity to really partner with them and try to create some seamless transitions of care from the acute setting to the subacute setting, and then back to either home care or outpatient services. Or to be able to go from acute rehab to subacute or subacute to acute rehab. So really looking at what the patient's needs were in their disease process and how we could best meet those needs through developing a program that aligned very closely with the hospital's acute program. So together, we worked on developing standardized, comprehensive strategies utilizing an interdisciplinary team approach to be able to do that. Through that process, we also found from the American Heart Association that there was a national certification for stroke. So we began to compare what we were putting together to align with the hospitals, as well as what was necessary for AHA national certification. And we found that, first and foremost, they aligned very closely. Secondly, we were already doing about 90% of what was necessary to receive certification, but there were were some areas that we really needed to focus on to get us all the way there. Our primary goal through this whole process was to make sure that not only were we providing the highest quality of nursing care and rehabilitative care, but that we were also educating the patient, the family, and any other caregivers to that disease process that brought them in so that they could learn how to better manage it to prevent any future strokes. Okay, next slide. So we did that through the development of standardized educational materials, and then again, looking at what our hospital partners were providing at the acute level and what the American Heart Association had available so that we could make sure that our standardized educational materials aligned very closely with what was out there. We wanted to provide that education, including stroke recovery, prevention, self-management, and also linking a person and their caregivers back into the community resources that were there, again, to create a successful transition back to home after they completed our program. And again, the goal of the education is to support improved outcomes, successful community transitions, and reduce hospital readmissions related to neurological conditions. Part of that also was making sure that we were tracking our outcomes so that we could go back and meet with those same hospital partners and show them the successes that their patients were having when they came to the subacute level of care. And then again, the transition back to home or to another lesser care setting, such as possibly assisted living, group home, that type of thing. Next slide. And I'm going to turn it over to Katie now.
Thank you, Diane. Good morning, everyone. My name's Katie Nichols. I'm the Clinical Network Manager with Future Care. As Diane mentioned, we were very excited to learn about the American Heart Association's initiative for stroke certification in the subacute rehabilitation. So our facility team met and reviewed the requirements for obtaining that certification. Also, as mentioned, we had already felt that our program was on the right pathway moving forward. So all we needed to do was really start gathering our data to submit for certification, just working on those finer details. We identified roles and responsibilities for each of our team members that would really benefit the success of the program. And we wanted to make this a complete team approach so that each team member was buying into the success of the program, and which would enhance our sustainability once our certification was achieved. It also helps each person feel that their participation is not just part of the success for the program, but that we can't do it alone. We have to do it together as a team. We reviewed our policies and pathways to make sure that they were in alignment with the current guidelines recommended by the American Heart Association and the current evidence-based practice for stroke rehabilitation. We modified pathways as appropriate. And then our interdisciplinary team worked together and created tools that we used for weekly patient rounding, patient education, and also to track our metrics that we were measuring. And those tools that we developed, again, as a team, were definitely modified multiple times during our certification process. And they were modified based on feedback from all of our team members. So the certification tools that we put together allowed each discipline to sign off or document the completion of a specific education topic that they provided or a responsibility that they had to work for the stroke rehabilitation program. It helped us ensure accountability for each team member and also allowed the team member to feel like they were being part of the success of the program. Again, working with that team approach. As a team, we also reviewed areas of opportunities. We collaborated monthly, sometimes more than monthly, depending on what opportunities may arise. We didn't wait. We just, if we were at a meeting, we talked about areas of opportunities. Some of our speech language pathologists found some additional cognitive learning tools that they felt would really help for stroke patients in the program. We brought those to the interdisciplinary meeting. We talked about them and then ended up adding them as part of some of our educational tools and handouts that are given to the patients and family. I would say one challenge that we recognized as we were going through our successes and opportunities is that many of the patients that we were seeing come from the hospital setting were in such a debilitative state and had suffered such a severe stroke that their level of functional decline, even though they completed the stroke rehab program and made progress in therapy, they didn't quite make the progress that allowed them to always return to the community. Only really because some of the modifications that they may have needed to make for their home, such as handicap accessible, et cetera, families didn't necessarily have the affordability to be able to do so, or the support, the caregiver support to provide at home. So we continue to work on different resources daily with our social work team. Again, our goal is to get patients home, but that was one of the challenges that we identified during the process. Next slide, please. Another area of opportunity that we discovered at our Future Care Canton Harbor location is the population surrounding the facility has a higher Spanish-speaking population in the community. So we were seeing a lot of residents that were coming in that were Spanish-speaking only. We currently offered the iPad interpreter services, the Lingual Links line, multiple other options, but we realized that a lot of our written material that we provided for education while we were working with the patients and families, it was not translated into Spanish. So it was some of our therapy team that brought that to our attention. We went to the American Heart Association's website and utilized a bunch of their tools that are already translated into Spanish. So we were able to use those so that we could not only continue to provide the current education verbally through our iPad interpreter and Lingual Links line, but also to be able to provide a written handout that was translated into their language. Next slide, please. So our Future Care Canton Harbor location achieved a national certification in January of 2026. We were very excited. We were able to celebrate our accomplishment with pictures on social media, updating our brochures with our certification logo, spreading the word to the community and our hospital partners about the incredible achievement that we had obtained. So the question is, what's next? Where do we go from here? Really, the piece that we felt was very important was not only obtaining the certification, but being able to sustain the certification. So our interdisciplinary team continues to meet. We discuss areas of opportunity that will help continue to grow and enhance our program. We work closely with all of our team members, getting their feedback as to different areas of opportunity for us. We continue to revise our policies and pathways based on any updates to the current evidence-based stroke care and treatment. One thing that I thought was really exciting is we're actually in the process of developing a highlights bulletin board in the facility. And this is really for the staff so they can see how the program has grown, where we are, what opportunities were identified, and where we're kind of at in that process of working towards obtaining those or overcoming those opportunities. We work with our social workers. We provide information when patient discharges on social stroke support groups, et cetera. And those seem to be changing quite frequently in different hospital and outpatient settings. So just ensuring that all of our information and community resources are up to date. And then also tracking our successes that support a successful return to the community. We want to make sure that we connect our patients back to the community with what they need. We're continuing to track our data outcomes, reporting our information quarterly to the American Heart Association, getting feedback from them on areas that we could possibly enhance our program. And also we are celebrating our successes every day when the patients discharge, or I should say each time a patient discharges, that we do a celebration with a graduation certificate and kind of a parade that helps recognize not only the patient discharging home from the program or back to the community, but also celebrating those caregivers in the facility that have cared for those patients throughout their stay, just to really recognize our staff and support the success of the program. So that really concludes the Future Care's journey on achieving our stroke rehabilitation certification. I'm going to pass it on to Marquis.
Hello, everybody. My name is Valerie Lohman. I am the Regional Director of Specialty Services for Marquis. Next slide, please. Transforming care, how an AHA stroke certified SNF impacts the system of care to improve patient outcomes. So over the next couple of slides, Tricia and I will go through some of the things that we've experienced at Marquis. As mentioned, we've had our stroke certification for over a year and a half, and we've really learned a lot through the process. How a skilled nursing facility with a certified program plays a key role in impacting the outcomes for our hospital partners, our downstream providers, and most importantly, our patients. Next slide. So what we did, we actually took the American Heart Association's 6 pillars of the program. And as you can see here on the screen, program management is the first one. An interdisciplinary committee approach overseeing the post-acute care stroke program, coordinating the needs of the incoming and outgoing side. So working with our hospitals, working with the post-acute partners, downstream providers, home care agencies to make sure that they are aware of the program management. The next pillar is the personnel equipment. And again, equipment for the personnel inside the facility is really important. As you've heard from the previous presenters, really important to make sure that the staff is aware of the program, what the requirements are, and what the expectations are. Equipment should be customized for different levels of care through collaborating efforts, focusing on supporting ancillary staff and recognizes change in patients' conditions and needs. The next pillar is the patient caregiver education and support. There is a dedicated effort to provide education and support for the patients and their caregivers, particularly regarding stroke awareness and management, to make sure that they are aware of those subtle signs and symptoms of a stroke and make sure that they are aware of what to do when those subtle signs and symptoms are present. Care coordination, big part of our patient's plan of care at Marquis. The program, the effective care coordination is essential throughout the stroke patient's stay, from the admission to addressing the critical domains to ensure comprehensive treatment. So prior to admission to discharge, and then follow-ups after the fact to make sure they are on their right path. Clinical management is the next pillar of the AHA's stroke certification, and we really use that from a management of care for the stroke patients. Post-acute is vital, aligning and establishing hospital partnerships and pathways, making sure our hospital partners, all that hard work that was done at the hospital continues in the SNF behind our walls here. We want to make sure that everything that was identified in that stroke, what kind of stroke happened, what happens with that stroke, what's the intervention, is continued in our care. And then the last pillar, of course, is the performance improvement. What can we do to continue to make and improve our initiatives? What can we do to continue the measures adhering to the clinical evidence, the best practices, ensuring the highest standard of care are maintained? These pillars are collectively aimed to enhance the quality of care provided to the stroke patients and assure a systematic approach to treatment and recovery. The next slide. So what I'm going to do here is break down a little bit as to what I just spoke about, the program overview. It's a multidisciplinary approach tailored for the individual needs. This approach really starts from prior to admission, what kind of stroke the patient had, and what we can do from a nursing perspective, but also from a social services, physical therapy, interdisciplinary perspective to ensure that they achieve and get to their goal. What is their goal? Designed to improve mobility, communication, and independence. So the program overview really is the team's effect and the team support of the patient's outcome. We have several key services. We have a dedicated stroke focus. We have patient education and materials, and Tricia will go over some of that with you. We have physical, occupation, and speech therapy 7 days a week. We have physical medicine, which is our physiatry team, and rehab physicians as well, to ensure that these patients' goals are met and that we are moving in the right direction. Specialized features, stroke state-of-the-art equipment. So we've learned throughout this stroke certification, there are different types of equipment needed for different types of strokes. We've acquired light gates. We've acquired synchrony. We do have physical therapy modalities that make sure that we are working with the patient, what we need to do to ensure that they are moving in the right direction with their rehab. We have individualized care plans. So everybody is different. Whether it is from, like somebody had mentioned earlier, I think it was Haley had mentioned about the PHQ-9, your social determinants. Where is your next level of care going to be, and what are you doing about that? Focus on stroke prevention, education, and risk reduction. And then, of course, emotional sensitivity for all staff and our patients as well. The program benefits, we've seen a lot of benefits over the last year and a half, accelerated awareness of signs and symptoms. So as we teach and as we grow these programs and we onboard more programs, we're finding these subtle signs and symptoms as we educate our staff and the patients, and the awareness is really coming to fruition, which is great. Increased functionality, independence, and quality of life, and then culture enhancements and sensitivity for the quality of life change. And one of the big things that we are finding is depression. Depression is a big part of a stroke. So making sure that the patient is seen also by inside services as well. The team approach, led by experienced physicians, therapists, dietitian, nursing staff, and of course, our recreational staff. 24/7 medical care and monitoring for patient safety. So we do have 24/7 care in all of our centers. Collaboration with primary care physicians and specialists. And again, making sure these individuals have a follow-up appointment prior to discharge with their primary care physician and any specialist within 7 days of discharge. That really supports the continued plan of care. And then the program results. Our quality scorecards with the length of stay, return to hospitalization, and of course, our caseload are looked at monthly, and then we do upload them to the QCT on a quarterly basis, and working with the AHA for those, suggestions and interventions to, of course, advance our program. And then, of course, our outcomes, case studies, and testimonials assist, giving everybody in the community what our program is about, an overview. So we have a best practice, just as mentioned prior to this, is we have clap outs that we do. So we actually celebrate individuals who leave with a clap out. They walk the red carpet and they see where they were and where they're going. We also do some outcome studies from a clinical perspective that we bring back to our partners. So it's really important for the hospital and our downstream providers to know that all the care that they provided at their level is continued in our level. Next slide. Okay, Tricia.
Thanks, Val. All right, so in continuing with the discussion regarding our preparation for our stroke certification, the staff education was a big piece. As you all know, if you've investigated looking into stroke certification, it is all inclusive, right? All staff. So I found that the most inquisitive staff members were your housekeepers, your dietary aides, your maintenance directors, being involved in asking some questions regarding signs and symptoms, learning about having the patience to work with this clientele, realizing that they're at higher risk for aspiration and what do we need to do for that. So really helping and having alerts for non-clinical staff members was a large focus for us and a big takeaway, as those individuals are in the rooms quite often, and sometimes even more so than all of our clinicians put together. So that was a big takeaway for us on what we gained. We did have a lot of education regarding splinting and turning, communication and skincare. Do we have all the right equipment to support the patients who would be coming in with any type of stroke? We did a lot of education regarding fall prevention as we do recover the patients to a certain point. I know that was pointed out before, but not always to the full potential. And so as we get excited to move and walk, what are we doing as well to ensure we don't have any future falls with this clientele? And we did involve our practitioners and physicians for educational seminars to assist us in fully understanding stroke recovery. Next slide, please. So as Marquis likes to onboard different types of specialized services, while we felt we were managing our population fairly well and up to the standard of practice, it certainly doesn't speak as loudly as the American Heart Association stamp of approval. This is something the community recognizes. This is something that the patients and hospital systems have confidence in. And in addition to that, it's assurance that that SNF has been vetted based on the professional evaluation and criteria. So truly, as we look to remain relevant and as we look to ensure the patients get the best care, education is something that is never ends. And going for certification was something that we knew we would want to do and set forth in accomplishing. Next slide. Some areas of potential collaboration that we recognized. We are committed to supporting our hospital partners and improving that progression, making sure we remain innovative as suggested, as well as access to specialized and high acute care models. As we know, patients come sicker and quicker into our walls. We had a heightened focus that we recognized in needing to connect our skilled nursing centers to those hospital stakeholders. So we set out to really make those connections. And I'll tell you, sometimes it's not easy to do, despite your connections that your business development folks may have. We leaned in on AHA, asking for assistance, and certainly what that was provided. We also had a heightened focus to ensure that our consumer were able to understand that this is a differentiating, service line that perhaps isn't everywhere. So how do we ensure that our patient population are able to make an informed choice with this alignment? So, making sure that our hospitals knew all about it and getting the word out was a heavy lift, right? In ensuring that they could assist in making patient choice. ACO collaboration was another big one, ensuring that all of our partnerships, all of our organizational models were aware of what we were doing and how we were continuing to support the hospital needs. We also found some, acute rehabs really interested in understanding what we were doing, as this may be something that differentiated us from them even in certain ways. And really, the biggest potential collaboration would be the downstream service alignment, right? Where do we send this population who's one of the most fragile? How do we ensure they get the continuity they need? So all of those pieces, I would say one of the biggest areas is the community involvement for these stroke patients and ensuring that we have services to continue to send them to after their initial recovery and rehab. Next slide. So as we look to advance the stroke care, together, we thank all of you for joining today to really listen to us and see what it is that stroke certification does. So we'd like to thank from Marquis for you guys for joining, and we know that your patients will thank you too. So thank you so much, guys.
Thank you so much, Tricia. Thank you so much to our presenters for leading today's webinar. As a reminder, you can submit questions for our presenters in the questions and answer, the Q&A feature located at the bottom of your screen. I did see that we did have a question come in, and we will get to that in a minute because it looks like we do have some time to field questions. As we're waiting for any additional questions to come in, if your facility is interested in learning more about our AHA certifications, feel free to scan the QR code located on the last presentation slide, and someone from our team would be happy to connect with you. All right, let me read out because this was a really great question. And I'll let probably their Marquis or Future Care or anyone feel free to come off mute to take this question. For patients who screen positive on the PHQ2 or PHQ9, could you please clarify the follow-up process? Are they referred to mental health services after discharge, or are they evaluated by a mental health specialist during their admission? Additionally, is the mental health consultation offered on-site, remotely, or both? So whoever wants to come off mute and field that, feel free to.
Hi, this is Diane with Future Care. So yes, if someone does screen positive, we do have consulting services, psych services that come into our facilities on a regular basis. So we would make that recommendation and they would be followed while they were still in-house. And then if needed, appropriate services could be set post-discharge as well. And we would make sure that those appointments were all in place. Great question.
All right. Thank you, Diane. Anybody else want to elaborate any more on that question before we move on?
Tony, it's Valerie, I'm sorry,
Yep.
from Arcadia. I just wanted to piggyback on what Diane said. We have the same services, which is great. And find out that we do several assessments on our patients, on admission, we're doing an assessment, and then we do it throughout their stay. So just making sure that the assessments are going in the right direction. If somebody does have a change in condition, we can also consult our specialists that come through through the centers to support that change. Because like I mentioned, depression is one of the big signs and symptoms of a stroke. Might not see it on admission, but might see it as they progress throughout their stay.
Thank you, Val.
Yeah, and for our mental health, if they do positive, we do have a telehealth iPad that we use to bring it to the rooms for consultation.
Perfect. All right. Here's another good one I'm going to field to the presenters. Do you collaborate with hospitals with stroke support groups? Do you offer caregiver support groups, or do you offer in-person and or virtual support groups? So that's a good question around support for patients and caregivers.
It's Trisha with Marquis. I think it's one of the bigger areas of opportunity. We have not really gotten associated with the stroke group yet. We have done a great job with better breathers or like silver sneakers or things of that nature to ensure that we are connected from a cardiac and pulmonary perspective. But stroke, what we've done with better breathers in the past has been hitching our wagon to our hospital kind of aligned programs. And trying to grow that as everything's gone virtual since 2020. Those groups sometimes are established and less like to come out for live kind of education sessions. So I think an opportunity on our side is to hitch our wagons to those hospital already services that they offer already in the community.
And Tony, I just before we move on, to piggyback on what Tricia had mentioned, it was one of our big takeaways, as we have one of our centers who is AHA stroke certified. So we did start partnering with the hospital recently, just within the last month or two, and we are joining via Zoom to their meeting, which is great. And what we're doing now is we are asking our physiatrist to support an internal meeting. So again, like Tricia had mentioned, this is our biggest takeaway from this certification. Again, things have changed through COVID and Zoom and Teams, but really providing the opportunity for our patients to Zoom in listen. And then on discharge, like we do with our Better Breathers, is we're going to be providing them with the link and a flyer on discharge so they can continue that Zoom from home. And of course, invite their families and friends to that as well. So thank you. Good question.
Yes, hi, this is Diane. And in the Baltimore, DC metropolitan area, again, we did that same thing in terms of partnering, looking at our hospital systems, looking at what support groups currently existed, both within the hospitals as well as just in the community at large. And what we found is that it's a mix. Some of our hospitals are having in-person, and we're connecting patients and families with those in-person meetings. Some are doing virtual, and so we're making sure that we connect them prior to discharge so that they feel comfortable participating. And then also our social workers do support groups within our facilities in different areas, as does our respiratory therapist runs our Better Breathers. He's certified to do a Better Breathers Club for our patients as well as the community. So we do that in-house. So it's kind of a combination. We've got social workers that are meeting with small groups internally, but we are also connecting with both live in person as well as virtual support groups within the communities, depending on where a person lives. But it is really important to make sure prior to discharge that both the patient and the family, the caregivers, understand where those resources are and how to tap into them quickly.
Wonderful. Thank you for that, Diane. Another question, does your physiatrist work full-time, or do you have multiple that come in and partner with your certified facilities?
So I can speak on behalf of Future Care with that. So we have physiatrists, different physiatrists in all of our locations. That's something that we've been doing for about 15 years now at Future Care. So the majority of physiatrists are working an average of 3 to 4 days a week in the facility. We do have a couple that are associated full-time with hospitals that have been doing coming in and providing daily coverage. The hospital has basically we've partnered with them and we are their full-time job, but they're actual hospital employees. We have others that are through a physiatry group, a national physiatry group, and they come in, like I said, 3 to 4 times per week, depending on what the caseload is and what the patient needs are. So they're working with all of our Vital Strong patients, not just our Stand Strong is our stroke treatment and neurologic disorder program. So they're working with all of our Vital Strong programs, depending on what the individual needs of the patient would be.
We do the same thing at Marquee. It's really I guess the foundation of rehab is the physician-led service line. So it's very similar. Some are hospital affiliated, some are privately kind of vendor services, but it certainly is a something that we all should look at as we run rehabilitation centers. And this is kind of, the ground, right? The foundation of what we do every day. So our service line is very similar to what was just described for those on the call.
At Jackson County, we don't have a specific physiatrist. We have a nurse practitioner that works Monday through Friday, and then we also have the telehospitalists that do nights and weekends for us, for our skilled patients to be seen or if they need anything.
Thank you, guys. Jackson County, this is a question for you all. For other smaller critical access hospitals listening today, what advice would you give about getting started with quality improvement initiatives that eventually support certification?
I would say just to not, make it more focused for like all patients that you see, because we are small and rural. We don't have a whole lot of like stroke patients, but some things we've implemented during this initiative was helping our inpatients and our outpatients as well. So, and our other skilled patients if they needed anything as far as like depression screening and like the fees and stuff. So, not to just have a tunnel vision on only stroke patients, but as to help your whole patient population as well.
Thank you. I think that concludes the Q&A section for today's webinar. I'd like to thank our presenters for leading today's webinar, and thank you for your participation in today's event. After today's webinar, you will receive a follow-up email with a survey on the presentation. Please help us plan and improve future educational events by completing the survey that will pop up on the screen immediately at the close of the event. The survey can also be accessed by clicking the megaphone icon on the homepage. You will receive an email from Zoom with a link to view the recording of today's presentation. On behalf of the American Heart Association and our presenters, thank you for joining us for today's event. This concludes today's presentation.